Hello my friends, today we will talk about a common surgery called a thyroidectomy. I know that facing any kind of operation can be scary. You might have many questions and worries, but please do not worry too much. Many people go through this, and doctors are here to help you. Your main doctor, called a surgeon, will perform the operation. You will likely meet them at a good hospital like St. Luke's Medical Center or the Philippine General Hospital. They will work with another doctor, an endocrinologist, who specializes in hormones. Together, they form a team to make sure you get the best care possible. Remember, knowledge is power, and understanding the process is the first step to feeling better and more in control of your health journey. So, what is a thyroidectomy? It is a surgery to remove your thyroid gland. The thyroid is a small, butterfly-shaped gland located in the front of your neck. Even though it is small, it has a very big job. It makes hormones that control your body's metabolism, which is how your body uses energy. Sometimes the thyroid can have problems. You might have a goiter, which is when the gland gets too big. You might have nodules or lumps, which could be cancerous. Or you might have hyperthyroidism, where the gland makes too much hormone, making you feel anxious and lose weight. In these cases, your doctors may recommend surgery to fix the problem and keep you healthy for the long term. Before the surgery, your doctors will do many tests to prepare you. They will take blood tests to check your hormone levels. They might do an ultrasound to get a clear picture of your thyroid gland. This helps them plan the operation carefully. You will also talk to an anesthesiologist, the doctor who will make sure you are asleep and feel no pain during the surgery. They will ask you about your health history to choose the safest anesthesia for you. It is very important to follow all of your doctor's instructions before the surgery, like not eating or drinking for a certain time. This preparation is a crucial part of ensuring a safe and successful outcome for everyone involved. This is also a good time for you to ask all your questions. Do not be shy. Write down your concerns and bring them to your appointment. Ask about the type of surgery you will have. Sometimes only one part of the thyroid is removed, which is called a lobectomy. Other times the entire gland is removed, which is a total thyroidectomy. Understanding what will happen helps to calm your nerves. Your medical team wants you to feel informed and comfortable. Remember, you are a partner in your own healthcare. Being prepared mentally and physically will help you face the surgery with a positive mindset, which is very important for healing. On the day of your surgery, you will go to the hospital. Nurses will help you get ready. They will check your blood pressure and temperature. You will change into a hospital gown. It is normal to feel nervous at this point. Your family can be with you to give you support. Soon you will be taken to a preoperative area. Here, the anesthesiologist will talk to you again. They will place a small needle in your arm or hand. This is for the IV, or intravenous line. Through this line, they will give you medicine that will make you feel very sleepy and relaxed. This is the start of the anesthesia process. When it is time for your surgery, you will be moved to the operating room. It is a very clean and bright room with a lot of equipment. The doctors and nurses will be wearing masks and special gowns. You might feel a little cold, but they will give you warm blankets. The anesthesiologist will give you medicine through your IV. You will start to feel very groggy, and then you will fall into a deep sleep. You will not feel anything, and you will not remember the surgery at all. The team is there to watch over you very carefully, monitoring your heart, breathing, and blood pressure the entire time. You are in safe hands. During the operation, the surgeon will make a small cut, or incision, in the lower part of your neck. They try to make this cut in a natural skin crease, so the scar will be less noticeable later on. The surgeon will then carefully move the neck muscles aside to reach the thyroid gland. Depending on your condition, they will remove either a part of the gland, which is a lobectomy, or the whole gland, which is a total thyroidectomy. The surgeon is very skilled and precise. They are careful not to damage the important nerves and glands nearby, like the parathyroid glands which control calcium in your blood. The entire procedure usually takes a couple of hours from start to finish. Once the surgeon has finished removing the necessary thyroid tissue, they will close the incision. They will use very fine stitches or a special surgical glue. A small drain might be placed in the incision to remove any extra fluid that collects after surgery. This helps with healing and reduces swelling. Then, a bandage will be placed over the area. After this is done, the anesthesiologist will slowly wake you up. You will be moved to a recovery room, where nurses will watch you closely as you become more awake. You might feel sleepy and a bit disoriented, which is completely normal after anesthesia. After the recovery room, you will be taken to your hospital room for your confinement. You can expect to stay in the hospital for a few days, maybe up to 5 days, depending on your doctor's advice. During this time, you will have a dextrose IV line in your arm. This gives your body fluids and nutrients while you are not yet able to eat or drink much. The nurses will check on you regularly. They will monitor your vital signs, check your surgical wound, and make sure you are comfortable. Your throat will likely feel sore, and your neck might be stiff. This is expected after the surgery. The first day after surgery is often the most challenging. You will be encouraged to rest as much as possible. It might be difficult to swallow, so you will start with clear liquids like water or broth. As you feel better, you can slowly move on to soft foods like yogurt, soup, and mashed potatoes. It is important to try to move your head and neck gently to prevent stiffness, but do not push yourself too hard. The nurses will give you pain medicine to help manage any discomfort. Do not be afraid to ask for it if you are in pain. Managing pain is a key part of a smooth recovery process. Your doctor will check the drain in your neck. Once there is very little fluid coming out, usually after a day or two, they will remove it. This is a quick and simple procedure. The nurses will also teach you how to care for your incision to keep it clean and prevent infection. You will also have blood tests done to check the calcium levels in your blood. This is because the tiny parathyroid glands, which are located near the thyroid, can sometimes be affected during surgery. If your calcium is low, you might be given calcium pills to take. Before you go home, your doctor and nurses will give you detailed instructions. They will tell you how to care for your wound, what foods to eat, and what activities to avoid. They will schedule a follow-up appointment for you. This is usually with your surgeon to check your incision, and with your endocrinologist to discuss the next steps in your care. Leaving the hospital is a big step, but your recovery journey continues at home. It is important to have someone to help you for the first few days. Remember to be patient with yourself, and allow your body the time it needs to heal properly. Once you are home, your main job is to rest and recover. Your neck will still be sore, and you will feel tired. This is your body using its energy to heal. Simple advice can make a big difference. Sleep with your head propped up on a few pillows to help reduce swelling. Avoid lifting heavy things or doing strenuous activities for a few weeks. Eat soft, easy-to-swallow foods. And be very gentle when you wash and dry the area around your incision. Protect your scar from the sun by using sunscreen or covering it with a scarf, as this will help it heal better and become less visible over time. A very important part of your life after a total thyroidectomy is taking your thyroid hormone medicine every day. Since your thyroid gland has been removed, your body can no longer make the hormone it needs. So, you must take a synthetic hormone pill called levothyroxine. You will need to take this pill for the rest of your life. Your endocrinologist will do blood tests to find the exact right dose for you. It is crucial to take it every morning on an empty stomach, at least 30 to 60 minutes before you eat or drink anything else. This ensures your body absorbs it properly. This pill replaces what your thyroid used to do, keeping your metabolism and energy levels stable. What happens if you do not take your hormone medicine? It can be very dangerous. Without the hormone, you will develop a condition called hypothyroidism. The symptoms include feeling very tired, gaining weight, feeling cold, having dry skin, and depression. If left untreated for a long time, it can lead to a life-threatening condition called a myxedema coma. On the other hand, taking too much medicine can cause hyperthyroidism, making you feel anxious, shaky, and causing a rapid heartbeat. This is why regular checkups with your endocrinologist are so important. They will monitor your hormone levels and adjust your dose as needed. Facing surgery and a lifelong medication can feel overwhelming, but please take heart. You are not alone on this journey. Millions of people live full, healthy, and active lives after a thyroidectomy. Think of your little pill as a friend that helps your body work well each day. Follow your doctor's advice, go to your follow-up appointments, and take care of yourself. Join support groups if you can, either online or in your community. Talking to others who have been through the same experience can be very comforting. You have taken a brave step toward better health. Be patient, be positive, and trust in the process. You can do this.